Hi, it's Dr. Fox, and in this video, I'm going to talk about the 3 biggest mistakes when trying to manage depression. Depression is a complicated mental health condition, and it impacts teens, young adults, older adults, many individuals throughout their life. So it's important to understand how to deal with it. And these 3 biggest mistakes are things that people do, but they have the best intention. They do these things. They're trying to be well. They're trying to manage it. The problem is that sometimes we do things with the best intentions, but we end up with adverse outcomes. So this video is about helping you not do those things. I'm also going to tell you ways that you can do it different. So let's get into it, and like, share, and subscribe, and let's go. So when trying to manage depression, there are a few common mistakes that people may inadvertently make. These mistakes can hinder progress and make it more challenging to effectively cope with your depression. Now, there are 3 mistakes. Here we go. The first one is ignoring or minimizing symptoms. First, it's crucial not to downplay or ignore your symptoms of depression. Now, depression is a legitimate mental health condition, and it requires attention and treatment. It is so important. Brushing off or denying the severity of your symptoms, or that the symptoms are even present, can delay seeking help, and it can hinder your recovery process, because as it exacerbates, as it gets worse, it's harder to treat. It's harder to attenuate and get control over. So the more you ignore it, the worse it can get. Now, recognizing the signs of depression and reaching out for professional support is essential to dealing with it. It's just so important. Now, these symptoms can include mood symptoms. Those can, believe it or not, can be anxiety as well. Anxiety can be a part of depression. People often think it's separate, but it's not. They work together in a loop. At the high end of that loop is that anxiety, is that worry, is that fear, is that restlessness. And what happens is that you have all this energy and concern with your anxiety, and it builds and it builds and it builds and it builds. And then you're up here. But what happens is that anxiety starts to fade, right? You start to get tired with all that worry and all that fear and all that concern. And then as you start to lose that energy, then we go into that depressive phase. And in that depressive phase, you've lost that energy. But while you're in that depressive phase, you're doing less. This could be sense of guilt, hopelessness, worthlessness, loss of interest or pleasure in things you once enjoyed. You could even have more mood swings. Actually, that could be on either side of that cycle, right? Even at the upside, it could be a little moody. Doesn't mean you're bipolar. That's something completely separate. And I have videos on that. I'll put a link right here if you want to check that out. But, right, it's that mood swings. It's that moodiness. It's harder because you're so tired, because anxiety just saps all that energy. And then there's that sadness component. Now, sadness and depression are different. Sadness is usually something that's short-lived, and you're kind of bummed about something, and you're sad that something didn't work out. Depression is something that is negatively affecting how you live your life, how you see yourself, how you interact in relationships, or perhaps if you're even isolating yourself, you're pulling yourself out of relationships, and it can impact your work as well, or school as well. So that's depression. Depression is that clinical term. Sadness, we all get sad. We all get bummed out. But depression is a really severe form and intensified aspect of sadness. Now, there's also sleep. Symptoms can include sleep. Absolutely. That's early waking. Could be excessive sleepiness like insomnia or restless sleep. Now, if you're experiencing depression, you may experience some or all of those things. Whole body. You have this excessive hunger, fatigue, that's exhaustion. You have loss of appetite or restlessness as well. Those are also symptoms. Behavioral. This goes back to what we mentioned just a moment ago. That's that agitation. Kind of being agitated, right? That irritability, things like that. Could also be excessive crying, or could be social isolation, which I mentioned just a moment ago. So those are some of the behavioral aspects. What about the cognitive stuff? What about the stuff in our brain a little bit? Well, it's that lack of concentration, slowness in activity, or even thoughts of suicide or death. Now, in that last component, suicide or death, you want to make sure that you are getting help. Even in all of these things, it's important to get help. But a lot of times people will have thoughts of death. They'll have thoughts of suicide. And they're afraid, oh, if I say anything, they're going to lock me up. I hope that doesn't happen, because a lot of times people come to me and they say, well, this is my fear, They haven't planned it. They don't have any intent, things like that. So we need to talk it out, because what can happen is that, remember, this first mistake that we're talking about is ignoring or minimizing those symptoms. If you address it, you shine the light on it, then we can work with it and deal with it. And then you're not afraid of it. You're confronting it and you're in control. And that's what we want. Another aspect of depression is weight. That could be weight gain or weight loss because you're not eating or you're not active like you used to be. And then lastly, there's some common ones, which is poor appetite or repeatedly going over thoughts. You ever have that one? Like something will happen. You'll have a conversation and afterwards, you're just thinking about it. You're thinking about it. You're rehearsing. You're wondering. You're looking into it. But what happens is when you're depressed, it adds this layer of distortion. You're not seeing things the way they are. You're seeing things in a very negative light. Depression impacts not only how you see yourself, but how you see others and how you see the world. And you're not seeing it in a more accurate way. You're seeing it in a depressed, distorted way. And that's absolutely what we don't want. Number 2, relying solely on self-help methods. While self-help strategies, they can be really valuable and they can be really great, but relying solely on them without seeking any professional help can be insufficient to managing depression. Doesn't mean in all cases that you have to go see a mental health provider, but if symptoms continue to get worse, if you're implementing those strategies in those books that you're reading or the videos, right, that you're watching, and some of that depression is still there, or a lot of that depression is still there, or it keeps getting worse, you need some intervention. You need to go to that mental health provider who knows what they're doing, who can help you construct a treatment plan to work on those things. Because depression is a very complex condition, and it requires a comprehensive treatment approach. This includes therapy. In some cases, it could even be medication. Now, seeking some guidance and assistance from a mental health provider, that can really help you, because hopefully it'll be personalized, that the individual whom you go to will get your history, will get your family history, also identify current stressors, current issues, and get a trajectory of this depression. Where it started, when it started, was it a situation or did it start to build? Could it be something that you just reached a particular age and it could be a brain chemistry issue? Could it be another issue? There's a whole vast just array of issues that could be causing it. So I think self-help stuff is great. I've written a whole bunch myself. I think it's wonderful, but it may not work in every case. And in some cases, you may need a qualified mental health provider to help you move forward. And that is an important thing. Number 3, here we go. Now that is isolating yourself and avoiding social contact. That's even one of the components we talked about of depression. Now depression can often lead you to withdraw from social engagement, social interactions. And the more that you isolate yourself, that gives your depression time to grow. It's like breeding depression. It's hiding in the dark, right? It's like a mushroom. And even though I like mushrooms, right? But we don't like depression mushrooms because they're in the dark and they start to grow and they expand in the dark. We got to shine light on it. That sense of isolation, distancing yourself for people that can help you get another perspective, get a greater sense of understanding. Those are important things that you need. Now, it can feel tempting when you're depressed to retreat from others, but isolating yourself, just like I mentioned, it can make things worse. It can add this sense of loneliness and worsen a lot of those depressive symptoms that I just mentioned. You want to build and maintain a support network that helps you recognize, build insight, and that encourages you, even if they're baby steps at first, depending on the severity of the depression. That's okay. It's doing some of those steps initially, and that's really important. Connecting with understanding and supportive friends is also critical. Healthy and supportive family members or in support groups can be really healthy. I know that in my office, I have tried to start some mental health groups in the past and nobody was interested. I was really surprised by that. I initially started my career doing 100% group therapy. Group therapy is amazing because you hear someone else's experience. And in hearing that experience, you're like, hey, I'm going through that too. How did he or she deal with it? Oh yeah, boom. And then you start building on that and you feel this sense of connection. That goes against what depression wants to do. Depression wants you isolated. It wants you in a weakened state so we can take advantage. Well, we're going to push back on that. That is absolutely what we are not going to do. So support groups can be great as well. And, like I said, having that sense of connection can be really important. And lastly, just managing depression, it is a journey that requires patience and self-compassion. It really does, and a comprehensive approach. There isn't one size fits all. And seeking professional help, practicing self-care, managing social connections, and staying engaged in treatment are essential steps to effectively managing that depression, and you can do it. Depression can be successfully managed, and it is totally, absolutely, 100% possible. So please hang on to the hope that I have that you can manage your depression. I've worked with countless folks who had severe depression, and they were able to pull out of it. And fortunately, they're all doing well. They're all getting there. Is it easy? No. Is it possible? Absolutely. Can you do it? Yeah, because they did it. And you can absolutely do it. Don't let your depression convince you that you can't. I hope this was helpful. Please like, share, and subscribe. Comment too, especially about group therapy. If you participated in group therapy, and what was your experience? Did you like it? Did you hate it? I would be very curious to know that. So again, I hope you enjoyed the video. I hope it was beneficial for you, and I'll see you next time. Thank you. Bye-bye.